Sup, chooms, how y'all living? Hope everything is Nova and you're all having a preem week. So, on virtually every video I make about Finasteride, I'll almost always get a few comments like, "Hey Kevin, thank you so much for inspiring me to start Finasteride so I don't have to be a slaphead for the rest of my life. I'm ready to begin." So, what blood work do I need to do? Should I test my DHT levels, my estradiol levels, or maybe my free testosterone levels? Look, chooms, I'm honored that my content helped inspire you to save your hair, but if you're watching my videos and you think you need to get blood work done either before starting Finasteride or while taking Finasteride, then I'm not getting through to you. You don't need blood work at any time in your Finasteride journey, and in fact, if you are getting blood work, you could be making things worse for yourself. I've actually discussed this before in a video I made a long ass time ago. It's one of my earliest videos, in fact. I made it before this channel even had an established identity as a hair loss channel. Back then, I was still kind of experimenting with the idea of making hair loss content, so it's likely many of my modern viewers on my channel haven't seen it, and perhaps because of this, I am seeing more and more people on my channel and other hair loss communities like Trestless think that they, for some reason, need to check their blood work before starting Finasteride. Then, when they do get results, they don't know what to do with it. So, I often get questions like, "But Kevin, my blood test showed that my SHBG level's on the low end of normal. Doesn't that mean I'm at more risk of getting side effects if I start Finasteride?" Please guys, just stop it. You are taking a 5-AR inhibiting drug for Pete's sake, not a chemotherapy drug. A blood test is not going to help you, and there is no blood marker that is going to predict how well you will respond to Finasteride or predict whether or not you will get side effects on Finasteride. You're wasting the time of the phlebotomist who is drawing your blood, and you're wasting your own time and money by getting blood work. In fact, getting blood work, it only complicates the treatment of hair loss. It can make people delay starting treatment while they chase down whatever slight abnormality they may see in their blood work profile. I've even seen people get blood work done and then decide that they can't take Finasteride because they think their estrogen levels are too high, and so they think they're definitely going to get gynecomastia on Finasteride, even though gyno is perhaps the rarest side effect one can possibly get on Finasteride. Or they'll start Finasteride and then decide that it isn't working for them because their serum DHT levels are still in the normal range. They think that since Finasteride is supposed to lower serum DHT by 70%, it means that it can't be working for them because their blood work says their DHT is normal. All this is completely wrong. So, if you're familiar with my channel or have already asked me a question about blood work in the comment section, then you probably already know that I have not been a big fan of getting blood work done. But I really wish more hair loss influencers would speak out against this because I think it is causing severe harm for hair loss sufferers by making what should be a very easy decision seem a lot more complicated than it really is. That's why I always say to just take the pill like an aspirin and forget about it. Finasteride is a beautiful drug, not just because it stops hair loss, but because it makes stopping hair loss so damn easy and convenient. 100 years ago, the idea of taking a pill to stop hair loss would have seemed like science fiction, but it is a reality today, and we should all be very grateful about that. But I don't expect you chooms to just take my word for it that blood work isn't important, nor should you. You are owed a valid scientific explanation as to why blood work isn't necessary for Finasteride users, and I intend to give you one. So, first of all, let's talk about measuring DHT levels. People give lots of reasons as to why they want to measure their DHT levels. They say they want to see if their serum DHT is elevated, often because they think the DHT level will predict whether they are at risk to get androgenetic alopecia, or it will predict how bad their hair loss will be. Or they may want to get their baseline serum DHT levels measured before taking Finasteride and then measure the serum DHT while taking Finasteride in order to see if it is lowering their DHT levels. They do this because they think they can tell how well Finasteride is working by how much it is lowering their serum DHT. Now, I'm not saying that any of these reasons actually make sense, but these are all common reasons that people have given me for why they think they need to get their serum DHT levels tested before or after starting Finasteride. So first of all, can you even tell if you are going to get androgenetic alopecia or how aggressive your hair loss will be based on testing your serum DHT levels? Nope, you can't. So don't even try it. When it comes to going bald, serum DHT is completely irrelevant. It plays no role in androgenetic alopecia whatsoever. So please, stop wasting your phlebotomist time. What's actually important here is scalp DHT. And it's not just scalp DHT anywhere on the scalp. It's specifically scalp DHT in the balding areas. Hair follicles in balding scalp areas have higher DHT levels than the follicles in the non-balding areas. So the DHT that causes androgenetic alopecia is concentrated in the hair follicles that are genetically programmed to go bald. It's not the DHT in your blood that causes hair loss. It is not only that, there is also more DHT in those hair follicles. The hair follicles from balding scalps are genetically programmed to have an increased sensitivity to DHT. And unfortunately, there is no practical way to really test for scalp DHT, and even if there were, it wouldn't really give you any useful information. Even if you are unsure if you have the androgenetic alopecia gene, you should always get on finasteride anyways as soon as possible, because if you wait until you've lost ground, you may not be able to get that hair back. As good as 5-AR inhibitors are at stopping hair loss, they're not nearly as good at promoting hair regrowth, so prevention is always the golden option for people who want to stop hair loss. And let's face it, chums, 5-AR inhibiting drugs have plenty of health and longevity benefits on their own, so even if you take them and it turns out you don't have androgenetic alopecia, you'll still very likely enjoy all the drug's other amazing health benefits, such as a reduced risk of heart disease, prevention of prostate enlargement, and reduced cancer risk even. I talk about a lot of that in my Brian Johnson series of videos, and actually went ahead and made a new playlist on that, so it will be easy for anyone who wants to watch those. So getting back on point, just testing the DHT levels in your blood is not going to tell you anything about the DHT levels in your hair follicles. But then you might wonder, is there any correlation between the DHT in the hair follicles and serum DHT? Well, if we look at studies of the serum hormone levels of people with androgenetic alopecia, there are some studies that indicate that people with androgenetic alopecia have slightly higher serum DHT levels than people with normal hair, but the results aren't very consistent and they're not useful in predicting whether or not you will lose your hair. Many of the early studies of serum hormone levels associated with androgenetic alopecia were small studies that didn't even look at DHT levels. For example, this study from 1981 found no correlation between serum androgen levels and the presence of androgenetic alopecia, but it didn't look at DHT levels. However, this was contradicted by this study that found elevated serum DHEAS levels in men with androgenetic alopecia. But this was a very small study of only 18 men, and it also didn't look at serum DHT levels. Then we have this study here from 1999 that claimed that vertex baldness was associated with higher levels of serum testosterone and serum IGF-1 levels. However, if you look at the table in the study, none of the p-values are less than 0.05, so none of the differences were statistically significant, meaning they probably were just due to chance. So in other words, it was a bullshit study. And amazingly, even at the relatively late date of 1999, this study didn't bother to measure DHT levels. This is the kind of trash I'd expect to see in a garbage medical journal, like Medical Hypotheses. Sorry, Rob, that was a cheap shot. However, the studies where serum DHT levels actually were measured didn't find them to be useful. For example, this study of men with early onset androgenetic alopecia found that serum levels of testosterone and DHT were not elevated. However, the ratio of DHT to testosterone was elevated. But this study didn't look at the average person with androgenetic alopecia. It looked specifically at families where men developed very early onset hair loss in their teenage years, so it may not be applicable to most people who have androgenetic alopecia. Here is another study that looked at serum DHT levels in both men and women with androgenetic alopecia. It found that DHT levels were higher in men and women with androgenetic alopecia. We know this because MAGA people had higher DHT levels, as you can see here. Now, I'm not talking about these MAGA people. MAGA in this graph is an acronym for men with androgenetic alopecia, which I think is pretty hilarious because a lot of actual MAGA men do have androgenetic alopecia, and that's probably because most of them believe in big pharma conspiracy theories, so they won't take finasteride and they'll try to stop their hair loss by drinking bone broth while praying to the ghost of Ray Pete. In case you can't figure it out, FAGA refers to females with androgenetic alopecia. Anyways, the graph shows that both men and women with androgenetic alopecia had higher levels of serum DHT than people with normal hair. However, there was so much overlap between the groups that you can't use an elevated DHT level to predict if someone has androgenetic alopecia. The study found that DHT levels did not correlate with the severity of hair loss, and it concluded that the usefulness of serum DHT levels in the diagnosis of androgenetic alopecia was questionable. In science, the word questionable is a euphemism for bullshit, meaning serum DHT levels were useless for evaluating androgenic alopecia. There are some other studies that have attempted to correlate serum hormone levels with the presence of androgenic alopecia. Like in this study, for example, it had 178 men with androgenic alopecia from China. Higher free testosterone and DHT levels were found compared to control subjects with normal hair. However, there was no correlation between the severity of hair loss and serum androgen levels. So even if there is a trend towards higher serum DHT levels in men with androgenetic alopecia, there is too much overlap with the levels seen in people with normal hair, and there's no correlation with the severity of hair loss. So getting your hormone levels tested to predict whether or not you'll get hair loss or to test how severe your hair loss will be is totally useless. Even if you get blood work to test your DHT levels and the number comes back normal or even low, it doesn't matter at all, because if you're losing your hair, you need to take finasteride. So whatever that baseline level may be, it's already too high. Remember, even women can get androgenetic alopecia, and their hair loss is still caused by DHT, even though their DHT levels are naturally much lower than men's levels. So please, chums, don't worry about testing your DHT levels. Just worry about not being on finasteride, because if you are losing your hair, that's obviously the problem. Okay, cool. So how about measuring DHT levels when you're already on treatment in order to see if finasteride or dutasteride is working? I mean, that makes sense, right? Well, actually, no. It doesn't. Most of the time what happens is someone measures their serum DHT levels, but then finds out that it's in the normal range. Then they'll go into full-blown meltdown mode and start screaming at me, "But Kevin, my DHT levels are still normal even though I'm on 2.5 milligrams of dutasteride per day. I must be a non-responder to the treatment, bro. So what's next? Do I need to get an orchiectomy and start taking female hormones?" So usually they'll say this, but then at the same time, they'll admit to me that their hair loss seems to have stabilized, but they'll still be panicking anyways because they made the mistake of getting blood work and now they're freaking out over nothing. So first of all, if you do just a random DHT blood level test while you're on treatment, then you're not going to have any idea what percentage your DHT is reduced if you don't have a baseline measurement of DHT. But even if you do have a baseline measurement of DHT, it doesn't matter what the percentage reduction is. The only thing that matters is whether you're losing your hair or not. If you're on finasteride, the chances of losing your hair drop exponentially no matter what your blood work may show. Even though the studies that looked at the reduction of serum DHT levels with finasteride showed an average reduction of DHT levels by 70%, that is not a universal rule. It is just an average, and it is entirely possible for individuals to experience less serum DHT suppression than that and still get excellent results from the drug. Also, there can be reliability issues when measuring DHT levels. Different labs use different techniques, different equipment, and they even have different standards as to what the definition of a normal DHT level is. Also, remember, chums, it is scalp DHT that is important, not serum DHT. So measuring serum DHT levels while on treatment isn't going to tell you anything useful. It's just going to make you more nervous and more likely to experience a nocebo effect because you're overthinking what is a simple and effective treatment. Please, guys, just take the damn pill and forget about it. Okay, so maybe now you're thinking, "But Kevin, even if measuring DHT levels isn't important, you've said before in the past that finasteride side effects are caused by an imbalance of testosterone to estrogen levels. So shouldn't I get blood work to test my estrogen levels to make sure it's normal, bro?" No, you shouldn't. Even though it is true that side effects from finasteride are caused by a ratio of testosterone to estrogen that favors estrogen, the fact remains that the actual value of this ratio depends on the individual. There is no absolute standard for what constitutes an abnormal testosterone to estrogen ratio, so even if you get blood work done, there will be no frame of reference to determine if your ratios are too far off. If you get side effects from finasteride, it's not going to matter what your blood work says because you're still going to have to deal with the side effects the same way. You're going to either have to push through, since those ratios usually stabilize on their own, or you're going to have to choose another 5-AR inhibitor, like using dutasteride if you're on finasteride, which is a perfectly viable option that I made a video on recently, which I'll link below. You can also choose to titrate the dose of the 5-AR inhibitor you're currently using, or you could just give up the fight altogether and spend all day on hair loss forums and subreddits talking about post-finasteride syndrome so you can scare other people into being just as bald and miserable as you are. And no, you can't predict whether or not you will get side effects from your baseline blood hormone levels either. There is no research that shows that whatsoever. So, there are some other reasons people give for wanting to get blood work done. For example, people ask whether they need thyroid tests or vitamin D level tests or some other tests in order to rule out causes of hair loss that are not related to androgenetic alopecia. First of all, those other causes of hair loss are extremely rare, and even if your hair loss is being caused by something other than androgenetic alopecia, like let's say a vitamin D deficiency, there is still a very good chance that you also have androgenetic alopecia, so you shouldn't think you're going to solve your hair loss by just taking a vitamin D supplement because your vitamin D levels are too low. I mean, if your vitamin D levels are low, by all means take a vitamin D supplement, but you should also take finasteride to rule out the possibility of hair loss by androgenetic alopecia. But the reality is that if you're losing your hair, the chances of it being caused by anything other than androgenetic alopecia is extremely unlikely, and the people who tell you otherwise want you to believe that because they're in the business of selling bullshit supplements and scalp massage programs, and it hurts their bottom line if you know the secret to stopping hair loss is as simple as just taking a pill once per day. Also, if your hair loss were being caused by something like a metabolic problem, then you wouldn't need a blood test to know that. That's because metabolic problems cause many other symptoms besides hair loss. For example, low thyroid causes severe fatigue, weight gain, dry skin, and a whole lot of other unpleasant symptoms in addition to hair loss. If you actually had a thyroid problem, you wouldn't need to be losing your hair to know that. The bottom line here, chooms, is that if your doctor suspects something is going on besides just ordinary androgenetic alopecia, he or she will order the appropriate tests and prescribe the appropriate treatments. And if you're taking finasteride, then you should already be seeing a doctor to begin with. There are rarely other factors that can cause hair loss besides androgenetic alopecia, but you are not qualified to diagnose yourself. You need to see a doctor. So, I know what some of you are thinking right now, but Kevin, sure, maybe blood tests aren't important, but what about other tests like genetic testing or testing the sulfotransferase enzyme to determine how well I'll respond to minoxidil? That's gotta be useful, right, bro? Well, no. All that is universally scamful as well, I'm afraid. It's not possible for any of these genetic tests to be 100% predictive because the genetics of androgenetic alopecia are very complicated and not fully understood. There are over 250 genes associated with androgenetic alopecia, so anyone who says they can sell you some custom hair loss program or treatment based on your genetic profile is selling you a snake oil. All they're trying to do is create a demand for something that isn't necessary. They're the hair loss equivalent of the squeegee men I see at every goddamn traffic light whenever I'm driving in downtown Denver. They're always trying to sell me window cleaning, even though my car already has a built-in window cleaning device in the form of a windshield wiper and windshield wiper fluid. I know it's not what people want to hear, but the fact of the matter is that the only way you're going to determine how well you're going to respond to treatment is through trial and error. You need to stop wasting your time with all the blood work and the testing and just take your treatment. If you don't respond well or it isn't effective enough, then your doctor can adjust your titration in order to find something that works for you, but no blood test or genetic test is going to tell you or your doctor what kind of treatment you should be on. In addition, some of the companies offering this testing seem a little scammy, like this site here that claims it can customize your hair loss treatment based on the results of genetic testing. This reminds me of people who say what you eat should be determined by your blood type. There is no evidence that genetic testing is helpful in determining a proper treatment protocol. You either have androgenetic alopecia or you don't, and everybody who has androgenetic alopecia should have a treatment protocol that looks similar, meaning either finasteride or dutasteride taken as soon as possible, and possibly with the addition of a growth stimulant like topical minoxidil. As far as the whole sulfotransferase testing thing goes, there is no test that has proven to accurately measure this, and it's likely that normal levels of this enzyme aren't well defined, and it could vary from individual to individual based on what constitutes a good enough level to get a good response from minoxidil. I talked about this in my tricho test video, which I'll link below, but the bottom line here is that just like with everything else, if you want to find out if you're a good responder to minoxidil, then just use minoxidil and find out. If after a year you're confident that it isn't doing anything for you, then you can consider adding topical tretinoin to upregulate the sulfotransferase enzyme, or you can use a stronger concentration of topical minoxidil, and I made videos about both of those subjects linked in the description. Also, sometimes people ask me if it's necessary to get a baseline PSA level before starting finasteride or dutasteride. PSA, for those who don't know, stands for prostate-specific antigen, and it is a blood screening test to detect prostate cancer. However, people often have the idea that taking finasteride or dutasteride messes up the test. They think that because 5-AR blockers do lower PSA levels by about 50%. We know that because it was seen in the original large randomized controlled studies of finasteride and dutasteride in the treatment of benign prostatic hyperplasia, aka BPH. Finasteride at a dose of 5 mg per day reduced the PSA level by 50%, and at a dose of 1 mg per day, it reduced the PSA level by 48%. Dutasteride has the same effect. At a dose of 0.5 mg per day, it decreased the PSA level by 50%. So, people think that once they are on finasteride or dutasteride, they won't know what their true PSA level is because either drug will lower their PSA levels by about 50%. So they think they should get a baseline PSA level test before starting finasteride or dutasteride, or maybe they think the PSA test is useless because they are already on finasteride or dutasteride and then never checked their baseline PSA. So they think the PSA results can't be properly interpreted. Maybe the test result would be in the normal range, but if they weren't on a 5-error blocker, it would have been high, so the PSA would give a false negative result. I've actually heard this before, even from other urologists, such as that quacky doctor, Dr. Peter Attia, interviewed on his show, to whom I made a response video that I'll link below. But like I discussed in that video, this interpretation doesn't make any sense. First of all, these drugs lower the PSA by 50%. All the doctors have to do is double the result and see if it is still in the normal range. This is exactly what doctors do, in fact. But not only that, being on a 5-error inhibitor like finasteride actually improves the sensitivity of the PSA test for detecting prostate cancer, which is a huge plus. And that's actually true for dutasteride too. Also, keep in mind here, chums, that the recommendations from the CDC for PSA screening are that it should only be considered in men between the ages of 55 to 69 years old. It is not even recommended for men younger than 55 years old or older than 69 years old. So if you're younger than 55 and starting a 5-error blocker for hair loss, you shouldn't feel that you need a baseline PSA level. Or if you're already on a 5-error blocker, and let's say you're in the 55 to 69 year old age group, you shouldn't regret not getting a baseline PSA level or think that the test is useless because the 5-error blocker will mess it up. It's simply not true, chums. If you do need the test though, the doctor will just double the result in order to see if it is normal. You don't need to go off the drug to get a baseline PSA level. That's false. The one thing you actually need to do though is tell your doctor you are taking a 5-error blocker, and chances are your doctor will already know that because they have full access to your medical history. So it's a complete non-issue unless you're getting your finasteride from some shady gray market pharmacy, in which case you probably need to make sure your doctor knows that. So that pretty much wraps up the story on blood work. Maybe if your doctor suspects something on your physical, then they may decide to order some blood work for you, and that's perfectly fine. But please, don't unilaterally on your own accord decide that you need blood work. You don't. And even if you do, you're not the one qualified to make that determination. The fact is that there's no point in ordering your own blood work and then finding out that you can't even interpret the results. Even worse though, you may end up deciding that the blood work shows that your 5-error blocker isn't working or is more likely to cause side effects, and you end up abandoning a perfectly fine and effective treatment because you decide to go full-blown crunchy mom and do your own research. Forget about doing your own blood work and judge the results of your treatment by how effectively it stops your hair loss. That's the only way you're going to know how well something works for you, through trial and error. So if you want to stop hair loss, you're going to have to show the grit, guts, and balls to just take the damn pill. It's really no big deal, chums. The fact is that these treatments like finasteride and dutasteride are extremely effective and will stop and reverse hair loss in the vast majority of people. But if for whatever reason you're concerned about your progress, then you should get an objective measurement rather than just declaring the treatment is ineffective. Self-assessments are not reliable, so you can't just look in the mirror and say the treatment isn't working for you. That is why everybody who is on finasteride should be seeing a dermatologist, because they can use tools like a phototrichogram to see how well you're progressing with treatment. That's much more effective than someone losing their shit because they see a few hairs in the shower after being on treatment for just 2 months or so. And please, chums, don't give up on treatment too soon. I've seen far too many people give up on finasteride after just a few months, which is way too short a period of time to evaluate the effectiveness of any hair loss treatment. You need 6 months minimum to assess the results of a treatment, but realistically, it can take over a year to really tell if something is working. It's shocking to me just how many people on finasteride don't know this, which leads me to conclude that many people are taking finasteride without a prescription because this is something their doctor should tell them. So please, patience, chums, and don't think you can take shortcuts by checking your blood work. It won't help and can possibly hurt by drawing you to invalid conclusions about your treatment. And lastly, please remember that if you overthink this, you're more likely to get a nocebo effect, and if you're getting blood work done, you're already overthinking things. So please, just stop. Okay, that's it for now. I think I'm going to go ahead and play the original Legacy of Kain on the PlayStation 5. I just saw it in the PlayStation Store, interestingly enough. So I'm going to be doing that, but I will be back with more content soon. Thank you so much for watching, Hair Loss Witchers. God bless.